thank you, Honorable Muhammad Usman, for agreeing to talk to us about local vaccine production.
Okay, thank you very much, Dr. Lass. I'm glad that you are having me finally on your program. Meeting with,
It's,
discussing with Dr. Lass.
yes,
Yeah.
it's my pleasure talking health with you.
Okay.
Sir, while you were in the House of Representatives, uh, local vaccine production was, a topical issue, and I'm aware of the Nigerian National Financing Tax Team (NIFT), where you participated actively in these activities, had a subcommittee on local production of vaccines that works very closely with you. So kindly describe what happened during that time and why we didn't make much progress before COVID-19 came and changed the situation.
Okay, thank you very much for that question. And let me say that because I need to give a bit of background,
Background.
history. Uh, During my time as the vice chair of the Committee on Healthcare, Services, then the National Primary Healthcare Development Agency, in conjunction with some health professionals, and I recall in particular the late Dr. Benjamin Anyene was the person, leading, this team. I was invited to join the National Immunization Financing, tax team as the vice chair of that committee. The chairman then, Honorable Chike Okafo, recommended I should represent the committee on that major platform. I agreed. And it was a very good experience that I had. And there, I recall in 2015, there was an international roundtable in Nigeria precisely on 15th December 2015, during which about 150 participants from both within and outside Nigeria were invited to discuss, to share experience, to give recommendations on issue of local vaccine production in Nigeria. And that really strengthened the resolve of the committee to make the committee as formidable as possible, getting all the critical stakeholders, required so that this issue could be pursued. And I recall subsequently during our meetings, we broke into about 4 groups. One, there was the group on evidence generation, 2, advocacy, 3, national immunization tax team, and then local
Vaccine
production subcommittee. So these 4 committees worked together earnestly. And let me also say that part of the research then shows the number of children who are dying on a daily basis as a result of these vaccine preventable, diseases. And given the population of Nigeria, even then as about 190, now almost about 200 million, we require to produce our own vaccine in order to meet up, our teeming generation of particularly infant children that were being born, because 2014 research shows that I don't know, you call it, is it health cohort, which shows that almost about 7 million children are born almost on an annual basis. And that is really a big number.
Huge number.
So without vaccine, to immunize and take care of them, it will mean the country will be having high mortality rate. Now, if you take...
Exactly, sir. Sorry to cut you.
Yeah.
I knew you were pushing for a bill on local vaccine production. Could you share what happened?
Yes. So
how far did you get with that bill?
I was more or less interfacing between 2 committees. One on the immunization tax team, as well as the local vaccine, production. And I recall then, for the immunization tax team, I was able, even to present a bill on the floor of the National Assembly, which passed first reading and I think second reading. And somewhere along the line, things didn't really work, the way I wanted it, because I wanted, the support, particularly of the agencies, to be able, to push it, further. Because
By the agency, you meant the
the
National
Primary Healthcare Development Agency.
Okay.
For that of local vaccine, production, we were yet to draft the bill, but then we were, if you recall, we were trying, to come up with a business plan, a strategic, plan. Certain amount of money was really required by the National Immunization Tax Team, as well as a consulting firm that was engaged, to work on this, to develop this business document on local vaccine production. And then, simply then, because of the sum of 30 million naira, the bureaucratic bottlenecks within the government did not permit release of that money. So because of that, I think that really discouraged the consultant from continuing with the work on the policy, because you require a policy, for that.
Okay.
So that didn't really happen.
So in other words, a consultant was working on coming up with a draft policy document that could be used to form a bill to be presented to the National Assembly on local vaccine production.
Yes.
But payment was a challenge.
Payment thing was a challenge, really, because the experts need to travel. He required logistic support to be able to also assemble the team, required team, for them to get all the necessary things, working. And that did not really happen. And I think that was what affected that move.
The progress.
Yes.
All right, sir. The good news now is COVID-19 came last year and made it more imperative on the need for Nigeria to have local production of not just vaccines but other drugs and other commodities that are being used in the health sector. And according to media reports earlier this year, the federal government released 10 billion naira to support local vaccine production. And you may recall that I think November 2020, the Federal Ministry of Health signed a memorandum of understanding with BioVaccine Nigeria Limited. That's is still on the Federal Ministry of Health website, that story. And giving rise to a joint venture between the federal government and May and Baker Limited for production of locally made vaccines. I recall that in 2017 July, there was also a joint venture agreement signed by the Federal Ministry of Health with May and Baker, where the Federal Ministry of Health, we have 49% and May and Baker 51%. So over 3 years after, from joint venture to MOU, what do you think should be the next step going forward? Let me also mention that in early this month, let me also mention that early April, there was also a report that 2 vaccine candidates are undergoing clinical trial. Locally made COVID-19 vaccine candidates are undergoing clinical trial. The Presidential Task Force Chairman was reported to have made that announcement. So with all that has been happening, MOU with BioVenture or BioVaccine Nigeria Limited, and the 10 billion naira released and the 2 candidates undergoing trials, what's the next critical step that should be taken to ensure that these efforts are sustainable?
Well, first let me say, maybe commend the government for finally also, voting this large sum of money, 10 billion, for this local vaccine, production, process, to commence. Let me also say that Nigeria has the capacity to produce its vaccine for its population. This was done, history shows that in 1940, we had a vaccine that was produced and was even exported outside Nigeria. In the 1970s, we had that of yellow fever. I think that of 1940 was smallpox or whatever, really,
Yes.
I can't remember. So that means Nigeria had the capacity as far back as that time. Not to talk of now when you have more educated people who are well versed in the area of sciences, in the area of health, and so many things you need to be able, you see, to do this. So what the government has done is really very good. But now it must be sustained, it must be pushed to its logical, you see, conclusion. The partners, that's Mayor and Baker that has, the Mayor and Baker that has
Yes.
come in now, that has signed the MOU, as well as the other, you know, should be encouraged. And money, this money shouldn't just be on paper. It should be released. Because one thing with Nigeria is sometimes, yeah, figures are mentioned, are
Yes.
paraded, but they are not released.
But in this case, there are reports that 10 billion naira was released earlier in the year. And I think for this MOU or the joint venture that was signed, government's contribution is not even money. It's more of the land, other preparations. But based on the COVID-19 pandemic and the need for Nigeria to play critical role in vaccine production, federal government has reportedly, according to the health minister, released 10 billion naira. But do you think that a legislative framework will be needed?
Yeah, either way, you know, the government can decide, you see, to fast track it, you know, by coming up with a bill. In fact, even before some of these things are concluded, really. And it can be either way around. The government can easily also, you see, come in with an executive bill. You see, this will really fast track its implementation and execution, you know, by the two arms, that's the legislative as well as the executive arm. I sincerely hope there will be the political will to push for this thing, because, like I always say, issue of political will is always a problem in Nigeria. I hope some interest will not come to distract the government from pushing, going ahead with this good agenda.
Thank you very much. I also hope that political will be demonstrated. Given the steps that have been taken, we will continue to watch and monitor the progress in that regard. Thank you very much, Honorable Muhammad Usman, Chairman, National Advocates for Health.
Thank you very much, Dr. Lass, and it's my pleasure.
You're welcome, sir.